Good afternoon. And yesterday we covered the common ear problems and their management. Today I'm going to talk about deafness in elderly, deafness in children, and some clinical conditions on vertigo. So the hearing mechanism, I think I would be able to remember the sound waves in the eardrum and the three ossicles. So sound waves are traversing through the air medium, and then ossicles are bone, so it's solid medium, and then you can see at number 4 level foot plate. When foot plate is moving, fluid in the inner ear, the perilymph is moving, and then the sound wave comes out through the round window. 9 is round window. So sound waves enter the inner ear and then it comes out, and we can catch these reflected sound waves also. So this sound transmission and reflection both happens in the ear. So round window release some sound and the mechanical energy into the middle ear. So if the round window is not there and there's no space in the middle ear, no air, so hearing mechanism will be affected. So you must remember, although the eardrum, ossicles, inner ear, everything is there, if the middle ear space is not adequate, there will be a problem in sound transmission. So the causes of deafness, yesterday we discussed about these things. I have shown you some pictures. So outer ear canal, if it blocked with something, then the sound waves cannot reach the eardrum. So these are the examples: impacted by otitis externa, that is generalized infection of the ear canal. Yesterday we discussed about the fungal infections, and there can be generalized otitis externa also due to allergic conditions, irritants going into the ear. There can be swelling of the ear canal. In the foreign bodies also, sometimes without our knowledge, we can insert foreign bodies, like mental retarded people can insert foreign bodies. So all children can put foreign bodies into the ear. So sometimes foreign bodies also can cause deafness. Sometimes without person knowledge, there can be foreign bodies. Malignancies also can affect the ear canal, completely blocking the ear canal, and of course conductive deafness. And I have given yesterday, I have sent you the note, the Word document. These things are discussed in detail in that note. Middle ear, the conditions in the middle ear, common ones are otosclerosis. That means the ossicle chain. There are three ossicles: malleus, incus, stapes. So malleus incus is usually not getting fixed, but the stapes can get fixed. It's a autosomal dominant condition, runs in the family, but everyone is not affected with the gene. So expression is variable. So the usually otosclerosis patients give family history. So a person coming with deafness, they are soft spoken. Remember, soft spoken because they hear their own voice very loud, so they come and mumble. They just say we also cannot hear what they talk because of this reason. So when you examine the eardrums are normal because it is not a problem of outer ear or eardrum. So we cannot see the ossicles, but we can confirm this by doing the audiogram. It shows conductive deafness. And the chronic otitis media, the second condition in the middle ear, when there is an involvement of the eardrum with perforation or the ossicular discontinuity due to the chronic ear problem, ossicles can get eroded. Then the patients can have conductive deafness. The cholesteatoma is skin in wrong place. That means skin should be only lying in the outer ear canal, but sometimes it goes to the middle ear and mastoid. So the skin, the basal layer, had the power of growing. So when the basal layer is growing, it can erode the structures it come across. So it is not a malignancy, but it's like locally invading cholesteatoma. So then you can get complications like brain abscess, meningitis also because of this reason. Cholesteatoma can spread into the brain. So these patients present with very bad smell coming from the ear. So if someone has bad smell coming from the ear with ear discharge, remember it could be a cholesteatoma. It is more dangerous than having chronic otitis media without cholesteatoma because of the potential complications. So if someone complains of bad smell coming from the ear, you have to take it more seriously because the osteitis also happen. The adjacent bone is also affected. And these patients, there is no conservative management. Always we have to do mastoidectomy to remove the cholesteatoma. The other cases with chronic otitis media, sometimes the ear is dry, the patient does not wish to undergo surgery, we can leave it alone without doing surgery. But for cholesteatoma, we have to always do surgery. Inner ear problems. So inner ear, I have mentioned 3 common conditions. It's presbyacusis. We all know presby means problems in elderly. So presbyacusis is a common problem. It's a universal. Everyone can get affected, but the age of involvement is variable. Some people are affected by in their 50s, but some people in their 80s also hearing is not so bad. But we have to remember one thing: if we don't correct this presbyacusis, patients' mental functions can deteriorate. That means they can get Alzheimer's disease, memory loss, dementia. So it's very important to correct the hearing loss in elderly people. Earlier, we were also not very keen to prescribe hearing aid. If the patient says, no, I don't want, we were also not interested. We did not force anyone. But nowadays, I tell the family, somehow you have to force this person and encourage to wear hearing aid, because having a dementic person in the family ruins other people's life also, not only the person's life. So very important to correct presbyacusis. Labyrinthitis is infection of the cochlea. So that can happen from cholesteatoma or chronic otitis media. Mania disease is an inner ear condition where you get fluid, endolymphatic hydrops. You know, there are 2 types of fluid in the inner ear. One is perilymph, other one is endolymph. So endolymph is in the membranous labyrinth. In the cochlea, you can remember, in the bony cochlea, you get a membranous canal also. In that membranous canal, you get endolymph. Sometimes this endolymph compartment is enlarging and then it exceeds the volume of the perilymph compartment also. So it attacks like it occurs in attacks. Patients complain all of a sudden that they have vertigo, tinnitus, and deafness and fullness. So cardinal 4 features are there. If all 4 features are there, it's not difficult to diagnose, because audiogram also shows deafness, low frequency deafness. But if patient has only 1 or 2 symptoms, sometimes it may be confusing. So mania disease also not an uncommon problem. So you have to ask about the vertigo. Vertigo lasts for more than 15 minutes. And attacks are quite severe. So patient may have to go to accident and emergency also due to the mania disease attack. So someone has severe intractable vertigo with vomiting and deafness, fullness, you have to suspect mania disease, because there you can treat it medically. And then the impacted wax I showed you yesterday, and you can remove it. You can use a wax solvent and then suck out also. So these are the foreign bodies. You can see on one side there is a insect. So this insect in the ear is very, very disturbing, because when the insect is moving on the drum, patient will feel severe pain also, and the insect can bite the eardrum also. So in an emergency like that, you must put some water into the ear. When you water, it can kill the insect, then the pain and the discomfort will disappear. So following the morning, you can go to the hospital to remove the foreign body. So it's very important to kill the insect by putting water or some coconut oil, sometimes the odiclone, whatever way is available. Sometimes difficult to kill the insect with water. Definitely a thick liquid like coconut oil or glycerin will help. The foreign body is small and there's some space around the foreign body, like this in this picture. Then we can syringe and take it out. You will be trained.
Excuse me, madam.
Yeah.
Madam, the slides are not moving, madam. You are still in the first slide. We can see only the first slide.
So what to do? You are telling me now only, no?
Hello? Madam, can you make it the full screen and change the slides there?
This is full screen, yes. You do it from the beginning now. Right. Yesterday also I discussed about this otitis externa. the ear canal is swollen, and then the sound waves don't reach the eardrum. This is one otomycosis, two types. On one side you can see candida curd-like appearance. Other side the black spots otomycosis due to aspergillus. Both conditions affect hearing by filling the ear canal, but otherwise no nerves are not affected. So you can see this patient has central perforation and a cholesteatoma. So above part you can see the keratin and the cholesteatoma. Lower part you can see the perforation. So these are perforation with chronic otitis media with central perforation. This patient you can see the ossicles also, and this is the malleus. The incus and stapes here, but large perforation. Here there's a large perforation and granulations in the middle ear also. So this patient has discharge and this redness due to granulation. So both patients need treatment. We can do culture and antibiotic sensitivity, and then start with topical antibiotic drops. Sometimes patient need systemic antibiotics also. Once this infection has settled, we can do surgery. This patient, you can see, we want to compare you with this. This is a normal looking eardrum. Here you can see a central perforation, and the vesicles are also seen. Round window is also seen. So this is a dry perforation. And here the lower part of the eardrum looks normal, but there is a small perforation in the pars flaccida or attic perforation. So I just want to tell you about signs of hearing loss. Now in elderly people, they also don't realize they have hearing loss. Sometimes the family does not realize. So that's how the memory loss happens when we don't treat the hearing loss properly. So have trouble in hearing the telephone ringing. So they cannot find they cannot follow a conversation when two or more people are talking. Often ask people to repeat when they are what they are saying. Need to turn up the TV volume. So some people they increase the volume of the television so the next door people also can hear. Have a problem of hearing because of background noise. So if there's like background noise, they cannot hear. And they think other people's mumble. They don't talk properly. So can't understand women and children because elderly people have high frequency hearing loss. So high frequency hearing loss. So women and children voices are high frequency. So they cannot hear. But when men talk, they can understand. So age-related hearing loss, the presbyacousis, we continue to talk about it. Comes on gradually as person gets older. It starts in families. I told you the affected age is different, but all of us can get affected. May make it hard for a person to tolerate loud sounds. So because they can't tolerate loud sound, when somebody is shouting at them, they can't understand. And it usually occurs in both ears, affecting them equally. There's a bilateral problem, universal problem, and this runs in the family. And if you talk very loud to them, they can't understand. So the loss is gradual, and they may not realize it. Conversations difficult to understand, and then man's voice is easier. Certain sounds seem annoying. Presbyacousis make tinnitus to occur. So tinnitus is they hear sound. Tinnitus is hallucination, auditory hallucination. They hear a sound when there is no sound. So it is a common problem in presbyacousis people. So tinnitus also make their life worse. So what are the causes for presbyacousis? Is hereditary. There is due to aging, you get changes in the cochlea, and atherosclerosis reduce the blood supply to the cochlea. Dietary habits may affect, and diabetes also getting more and more common among elderly people. So there is again endothelial proliferation in the blood vessels of the cochlea. So all these affect the cochlea. And noise trauma. When you are exposed to noise during occupation, the hair cells can undergo necrosis. So elderly people have worked in noisy environment during their younger age, and then the when the cochlea is affected, they can get presbyopia. Smoking and alcohol again affect the cochlear blood supply. Hypertension cause vascular changes and then blood supply affected. What are these drugs? So as doctors, we must know about these drugs. Certain drugs can affect the hair cells in the cochlea. So they can get deafness due to ototoxic drugs. So you can read the list of drugs I have given here. You can see common drugs also, salicylate. But if you take aspirin tablet, you don't get deafness. But if you take it for suicide, then you will get ototoxicity. And anti-malaria drugs, anti-cancer drugs like cisplatin, all these drugs are in this list. So before you prescribe ototoxic drugs, you must remember. If you can avoid them, you have to avoid the ototoxic drugs. If you cannot avoid them, you have to maintain a safe dose, and you should not prescribe two ototoxic drugs together. You give two drugs together, then the ototoxicity is more. And when you prescribe these to elderly people, because their metabolism is slow, they can get more problems. So how do you know that the person has hearing problem? So this is a questionnaire we can give to the patient. So there are about 8 questions. So you can read them. So we can know the disability of the patient by asking these questions. So you can see we are judging the handicap. Is it hard? Do I have a problem? Hard for me to follow conversation when 2 or more people talk? Do I have to train to understand? And do I misunderstand? Because sometimes you fill the gaps if you cannot hear something. And then sometimes you ask to repeat. Television volume you maintain high. So early detection of deafness. So first of all, you have to take the canal. And the whispered voice test, I told you there's a YouTube video uploaded by me. You can see how to do the whispered voice properly, because whispered voice test is a very good test. You don't need any equipment. You only need your own voice, and you can take individual ear at the same time. So please go through it and practice among your family members. And the audiometry, no, the whispered voices is equally good as audiometry, because you use the human voice, individual ears are tested. And I invite you to practice that among your friends and colleagues and the elderly people to detect deafness. So whispered voice test here again, and we have to tell the bisyllable words, and not one word, 1, 2, not like that, 25, 79. And then I don't have to repeat this, because when you go through the video, you will understand. So deafness is definitely diagnosed by audiometry. So we classify it into mild, moderate, severe, profound. Disabling deafness for an adult is more than 39 decibels. So if the deafness is around 40 decibels, then the person is disabled. So how do you plot this in an audiogram? You can learn during the appointment. So this is the audiogram graph. You can see one side it is decibel, other side is frequency in hertz, and 0 is the normal hearing. 0 is normal hearing. So you can do above 4 years of age. It's a subjective test, that means you need patient's cooperation. Air and bone conduction you can plot separately, and we use PO tone. So this is different from speech. So if someone has a disability, we may not detect it from PO tone audiogram, because we don't take voice here. So conductive deafness is bone conduction is better than air conduction. Bone conduction sound is half a box. So this is the half box. So this is half box right here, this is half box left ear. So this is left ear, and this is air conduction right ear, the circle, air conduction left ear, the cross. So these are universal symbols. So everyone in the world use these symbols. So it's easier to read the audiogram irrespective of the country it's done. So this audiogram shows presbyacusis. The lower frequencies are better at around 20 decibel. As the frequencies moving, you can see the hearing is going down. So how to cope with hearing loss? So when you have a hearing problem, you must accept it. And you can try to lip read, because when someone is speaking, you can look at the face, facial expression, gestures also, and ask the person speaking to reword the sentence and try again. Find a good location to listen. So what happens when you don't correct it? Isolation, frustration, communication problem, depression, and dementia. So how to talk with someone with hearing loss? So you have to be patient, and then good light, good facial expression is important, and try to find a quiet place to talk to them. It's very difficult for them to understand if you are in a group, so you have to individually talk to them. Do not hide your mouth. Eat or chew gum while speaking. Repeat yourself if necessary. Try to make sure only one person talks at a time. So, and don't loud. Loudness is uncomfortable. So the solutions are hearing aids, surgery, cochlear implant. Surgery you can do if there is perforation or ossicles are eroded, you can do surgery. Cochlear implantation you can do among elderly people also. If they are productive citizens, we don't deny them from having a cochlear implant. So treatment, telephone amplifiers are also there. They are called assistive devices. Sign language is another option. Speech reading, that means you lip read. Cochlear implant can be recommended for a severe hearing loss. So hearing assisting devices are when the doorbell rings, there can be a light flashing, or sometimes amplifiers for ordinary telephones, equipment to help listen to the TV, radio, stereo, like that. So these are the types of hearing aid. You can see there are totally in the canal ones. These are good for young people, but not for presbyacusis. For them, I prefer to give a behind the ear type hearing aid. Unfortunately, all elderly people also ask invisible hearing aids. So these are another example of pictures of hearing aids. So into the ear hearing aid, that is, you can see it is in the concha well, and it, skin color is matched, so no one can see the hearing aid. And this one is into the canal, see, very small. So what is the take home message in elderly, deafness in elderly? My main aim is to tell you that they can get demented, depressed, and social isolation. So first of all, you clear the ear canal, do the whispered voice test, and then if there's a problem, you must give a solution. And hearing aid environmental modification also has to be done. Hearing aid does not give normal hearing. So you have to tell them, don't have very high expectations. Sometimes they want to hear like a child. So you will never achieve that. So it is a device to help you, but not to correct your whole disability. And they should be worn all the time. Even I tell them to wear in the night. Don't keep them in the drawer. Hearing aid is a machine, not like spectacles. So you need service, battery change, and then you have to go to your audiologist frequently. So never expect service like spectacles from hearing aid. Batteries need to be changed, and then ear mold. When you provide a hearing aid, you have to make a mold also. That means according to the shape of your ear canal, you should have a ear mold. So the measurements are taken, and you must have a proper comfortable ear mold.